Communication is necessary for a normal, happy life. It's essential to our sense of well-being. We share our thoughts, feelings, needs, and dreams with one another because we are by nature social beings. When our ability to communicate is challenged, we begin to withdraw. When we are no longer socially interactive, we become lonely, frustrated, and even angry. Hello, I'm Marian Karpinski, a registered nurse and healthcare educator, and I'll be your host during this program. Communication touches every aspect of our lives. For most of us, communicating is a lot like breathing. We do it so naturally. We often don't appreciate how complex and sophisticated human communication really is until something happens that disrupts our ability to communicate. Our ability to use words or symbols that form a language is a uniquely human behavior. Speech is the most common form of communication we use, and it is one of the most complicated things we do as humans. No other animal uses memory and symbols or words to form a language. Besides using our brain to generate ideas and recall words, we use the organs and structures of the mouth and face to shape sounds into speech that we recognize. We use our voice box to generate vibrations, our lungs to push the air that carries the sounds of speech, vision to read gestures and facial expressions, and we use our sense of hearing to hear the message being sent to us. The speech-language pathologist is a trained professional who evaluates and treats disorders of speech and language. He or she helps to find the areas of the brain that are still working in order to bridge the gap caused by the stroke. Working with the speech-language pathologist, the individual learns how to compensate for language problems and how to develop other methods of communicating. Aphasia is one of the communication disorders that speech-language pathologists work with. About 1 million people in the United States currently have aphasia.
Aphasia is caused by a stroke or a brain attack. There can be a blockage of blood or a hemorrhage or a leak of blood in the brain, which means that you have loss of oxygen to those tissues. Those tissues will die without oxygen, and those tissues are part of the structure of the brain that perform the function of helping to communicate. As the caregiver or family member, you'll find that there's a great deal of behaviors that you're going to be confused about and wondering about. There's often a perplexing question of, is this person changed intellectually? Because the brain damage seems to have presented this barrier. Communication is so important to us in our quality of life and our ability to exchange information, and so you begin to wonder if the information's not there anymore. Perhaps a really good way to explain this is to use the analogy of this lamp. If we think of the person's brain, that is the information and all the knowledge that they've had over a lifetime is this light bulb, then we think of the source of electricity or the input being the person sending the signal, or the speaker. Then the signal goes up a lot of neural pathways like this cord up to the bulb. Now, there's no problem with them hearing. The input is good, and there's no problem with their knowledge. Where the problem lies is in this cord, and it's as though it were frayed and bent. And so the signal or the electricity does not come through consistently. May get through 1 minute, the next minute it's been twisted. And so when you say something to the person, they might seem to understand and then not understand. So it's getting the signal through to that person who's still the very same person. They still have the knowledge, their personality, all the life experiences. They've not been taken away. The problem is getting information, new information in, and then often for them to express it, to get it out. But it's important that you recognize some of the behaviors of this loved one now with aphasia. They'll withdraw. They may become almost fearful and paranoid because they fear that everything that was normal is now gone. People talk around them and act as though they're not there, or they talk and they can't understand them. It's like all of a sudden being in a foreign country. And you think something's going on around you. You might catch a word or two that you recognize, but you're not getting the message. And a person can become fearful about that. A loss of control, loss of the role that they had in their life and in their home and in their relationships can be damaged because of this. We don't realize until it's gone what a loss, communication deficit, or impairment can be. The goal of therapy is to find what's left, what residual skills still reside in the brain that the person can use. Our brains are very complicated and very complex, and we were often told we don't use all of our brain cells. So the goal is to find what areas of the brain are still intact and to try and almost exploit them. In other words, get them to do more than they used to do, to carry some of the burden of communication.
Since the loss of communication is such a devastating event, it affects both the person with aphasia and family members. Loss of self-esteem due to feelings of dependency, isolation, depression, and frustration often accompany aphasia. In addition, there may be physical impairments, such as paralysis, visual defects, and swallowing problems. Aphasia can disrupt family dynamics and roles. Family members find it hard to accept the changes in behavior and new ways of communicating. Everyone is grieving the loss of the person they once knew and trying their best to cope.
It was really hard to see my mom not being able to just talk. We always had such a great relationship and always calling each other on the phone and talking all the time and doing stuff together. And I remember thinking, like, my whole world has just shattered. It's in little pieces all over the ground and it'll never be the same. And it hasn't been the same since her stroke. We've had to do a lot of adjusting, but it's really hard to see someone that you love and care about not be able to just sit down and talk to you anymore. And I would get really angry. I'd get upset. I didn't understand why it had to happen. And she was so young still. She's just 70 when it happened. And I went through a lot. I don't find myself doing that anymore. I'm finding myself more thankful that we still have time with her and that she lives here now and we've gotten to know her and she's part of our family and we do so much together still. Even though she can't communicate, we still get to do a lot together, don't we?
Yes, that's right. She has come a long ways in learning each of his words, I mean, a lot of his words already. In fact, when we went over the last test he had on it, out of 180 words, I think there was like 6 that he couldn't put his tongue where it was supposed to be and pronounce them. But it was the other way around to begin with. It's very uncomfortable for me when he won't join in, and I feel I need to make up for it. I always feel embarrassed that he's not talking, so I'll talk for him, I guess.
My father was the one who always cared for us. We were always the ones he took care of. I have 3 sisters, and he always took care of us. And then suddenly, I was the one who had to make all these decisions about his life. I had to care for him. I had to decide where he was going to live, who he was going to live with, you know. And it was a very difficult thing to do, was to take over that job. It was emotionally difficult. It was just draining to every day get up and make decisions for 2 people, myself and my father. I've learned patience, but I can't expect the rest of the world to have the same patience with them that I have to communicate with them. It's just not, that's not possible. You got to carry on conversations with them, because otherwise who do they have to talk to? One of the things we do is talk about his past. We can talk about stories about us as children that he loves to tell. We can talk about, I can show him things from his past around the house here, and he can tell me about them, and it really connects him. At least we're communicating as people to each other still. And that's one of the things you lose is the ability to connect with other people.
all of us crave acknowledgement and acceptance. I think we tend to undervalue or take for granted the many ways in which we look for that acknowledgement and acceptance in our everyday conversations with others. All day long, in the simple ways that we communicate back and forth, whether we realize it or not, we are affirming that we belong, that we are accepted by others, and that our relationships matter. We maintain a healthy sense of self in and through these kinds of interactions. If our ability to communicate is impaired, our sense of self is threatened. In extreme cases, a complete loss of self is possible. We can actually feel dehumanized, less than human, if we don't find ways to be acknowledged and accepted in our everyday interactions with others. This is particularly relevant to the person that's having trouble communicating, obviously. But it's also important to realize that when a family member is having trouble communicating, everyone in the family is impacted. Everybody's identity is at risk. Think about all the changes that are going on. Family activities are going to change. People's roles in the family are necessarily going to change. Goals for family members are going to change. The mere fact that we have somebody in our family now that's having trouble communicating or that's had a stroke is going to change the way we think and feel about each other in fundamental ways. So when we're talking about the importance of communication, we're talking not simply about how to get information across to one another effectively. We're talking about how to maintain and foster a sense of connectedness. The important point here is that we need to do that on a day-to-day basis. We need to continually reaffirm that we belong, that we are accepting of one another, and that our relationships matter.
Here are some techniques that can reduce frustration and help family members communicate more effectively with someone who has aphasia. These techniques can be tailored to meet individual needs. Family involvement is a crucial part of aphasia treatment. It is important for family and friends to learn about stroke and aphasia and to understand the strengths and limitations of the person with aphasia. Set realistic goals and praise. Don't tell him he will soon be all better. Reassure him that it takes a long time to recover. Treat the person as a mature adult. Aphasia is not a lack of intellect. The person with aphasia still needs to feel in control of his life. Continue to value his opinion on family matters. Assume that the person can hear and understands what's being said. Avoid talking about the person in his or her presence. Minimize distractions such as radio, TV sound, or the sound of other conversations. Get the individual's attention before you begin to speak. Face the person as you talk. Maintain eye contact, unless eye contact is culturally inappropriate. Use gestures, facial expressions, demonstrations, pictures, or objects to help convey your meaning. These may help the aphasic person to see the benefits of using gestures and objects to break through his or her own communication barrier. Use the same forms of communication yourself. In effect, you level the playing field. It gives the message that acceptable communication can be speech, gestures, pointing, drawing, or writing. Use touch as a way of offering encouragement and support. Touch can help the person to focus and establish another way to communicate. Each person has different comfort levels when it comes to being touched by others. Be sensitive to those individual preferences. Speak slowly, using short, uncomplicated sentences. Use simple, everyday words. Don't bombard the person with too much speech, or allow more than one person to speak at a time.
What he hears, it's hard for him to process in his brain, in the speech part. And he has to I have to say it slowly, so that gives him time to go through his brain to grasp what I am saying to him. And once he connects that, then he understands. But if I talk too fast, he doesn't grasp it.
Speak in a natural tone of voice. Don't assume that speaking louder will help the person to understand.
When a person has a comprehension problem and isn't processing the information coming in, if you are going to say something to them, try to look at how you're going to express that, either that command or those directions or that question. Try and make it so that it's short and fairly direct, and you might need to repeat it, but if you do, repeat it in a redundant way, so that you might say, "Are you ready for breakfast?" And they're looking at you blank, you might say, "Is it time to eat? Are you hungry?" So you've given the same information. Then if you're going to give some directions or talk about something, try to limit it to one subject at a time, and then when you switch the subject or you're going to ask another question, let them know, we're going to change the subject now. We're not going to talk about breakfast. Now we're going to talk about getting dressed. So you announce the topic. It's easier for them then to follow that change of subject. Even if they missed part of the words, they'll catch the change of subject, and then they'll be ready to go ahead and probably process information better, rather than mixing topics and mixing ideas. If you're going to ask questions of them and ask for an answer or a response, remember it's much harder for them to respond to, "What would you like for breakfast?" Because then they have to be able to have the word memory of all the things that they might eat. Rather ask a yes or no question. Would you like cereal? Would you like eggs? That's much easier for them to respond, and they might be able to just do it by a head gesture, even if they're unable to say yes or no. I would remember that a head gesture is more reliable than what they might say. I've had patients who will say, "No, no." The head is going to be more reliable than the speech, because the speech may be misprogrammed, but it's much harder to misprogram a head gesture. That's a more natural language.
If the person is unable to say anything intelligible, try playing 20 questions. Are we talking about a glass of water? Are we talking about clothes? Use gestures, pictures, and objects when appropriate.
Ask him questions, because he can say yes or no a lot of times to a question that he can't get the whole sentence straight. Like I'll say, "Are we talking about a person? Are we talking about a place? Are we talking about food?" And actually, I ask him, "Talking about a person?" He'll say yes or no. "Talking about a place?" He'll say yes or no. And then, if we're talking about a place, I'll say, "We're talking about home. Are we talking about your home? Are we talking about, Terry's house?" And you just go through all that, and eventually, when you know the topic, then you can kind of understand what it is he's trying to communicate to you.
For some people with aphasia, written words can help to increase understanding and expression of ideas. Ask the person to read or point to words. Reading aloud can improve speech. People with aphasia often have a hard time finding a particular word. It may be helpful to repeat what he has said thus far. You can try using a sentence completion. "I want to put on my blank." He may be able to say, "I want to put on my shoes," by using the sentence completion, where he wouldn't be able to come up with the word shoes on his own.
I know it, I just can't say it out to you. I know what the thing.
And that's one thing, too, that we will do is start to say the word, and a lot of times that'll trigger it, and she can say it.
A routine daily schedule is helpful. Being in a predictable situation promotes a sense of safety. Repeated exposure to the same objects and events provides an opportunity for relearning language. Signs indicating objects or areas within the home can sometimes help a person to relearn language skills. Be honest. Tell the person that you can't understand what he or she is trying to tell you by saying, "I can't understand what you're trying to say," rather than, "You're not speaking clearly." Try changing the subject or coming back to it later if he or she is impossible to understand.
It can be very frustrating if your loved one or the person you're caring for is now starting to do a lot of swearing, especially if you never remember them doing that before. It almost seems uncontrolled to them, and in fact it is. They're not able to stop doing that. That occurs at a level in the brain that they just can't seem to stop it, and it's not anything that they are using appropriately, although sometimes it may feel that that's what they really wanted to say. Remember that they cannot control it. They will also be able to say one word one time, and then when you ask them to say it again, be totally unable to. And that again is the processing problem. We know it as apraxia, or just inability to program or voluntarily say what they want to say. It'll come out automatically one time. The next minute, they cannot use it when they really want to use it.
People with aphasia need time to understand what you are saying. It's important to be patient and allow them time to process the information and to find the words they want to say.
One of the things that was hardest for us to learn, but was the most important thing to do with Mom, was let her finish what she's trying to say. Do not try to put words in her mouth. Do not try to finish the sentence for her. And that's what we have tried to do, because how are they ever going to learn to communicate again if you're always finishing every sentence for them, or put everything into their mouth form and telling them what they're trying to say? And I think that's one of the hardest things. I see her friends still do it because they don't understand that. You just need to have some patience. Give them a little bit of time.
In normal conversations, we take turns. We are the speaker, and then quickly we become the listener. Sometimes caregivers anticipate the wants and needs of the person with aphasia, and the turn-taking becomes lopsided. The caregiver dominates the conversation. It is important that we continue an even exchange, even if the person's speech is difficult to understand. Keep a positive attitude. Take time to do the things you enjoy. Setting aside time for yourself will help you to keep a positive attitude. Emotional ups and downs are to be expected when someone has had a stroke. Try not to take it personally.
The one thing that they told us is that stroke patients will have emotional ups and downs, and they can hit really fast. 1 minute they can be laughing, next minute they can be crying, and that was really hard to see your mother, who I remember only one time in my life seeing her cry, and all of a sudden I see her bawling, just boom, and I would start crying, and it would be really hard, and I'd ask her, please don't cry. Now I know that's just part of her stroke. Has happened to her, and it's usually when she's really tired. And I just say, you know what, you need to go back to bed. You need to take a nap. And she does. She knows too now. Yep, I'm not handling life very well right now. I need to go back to bed. And
when you're caring for someone with aphasia, share the responsibility as much as possible. Don't be afraid to ask for help. Involve your family and friends in the process, or get outside help if necessary. Stimulate new ideas and topics by getting the person involved in outside activities. It can be helpful to take a walk or go for a ride in the car. Stroke clubs offer support, encouragement, and education for families who are coping with aphasia. Talking with other people about your experiences and feelings can give you hope and restore your sense of balance. Adjusting to the changes caused by aphasia can be challenging for the person with aphasia and for family members. Finding new ways to communicate and making the effort to communicate is an important part of the healing process. The techniques presented in this video have helped many families improve communication as loved ones work to recover speech and language skills. If you try just one of these techniques and it works, it opens the door to communication. It is well worth the effort.
I just go over and say, honey, we gotta be cool. And I try to, in situations like that.
You do.
This one is to purse your lips and your throat and throw a kiss. So close.
There are times we joke around and we tell her, do you ever shut up? Do you ever stop talking? Because it seems like there are times driving down the road all the way in town, all the way back, that's all she does is talk.
You mean you don't understand me when I'm telling you how funny it is?
Not always.
Oh, shucks. I know you did.